When a disaster strikes and people are injured, there's always a need for life-saving blood, but the supply is dependent on the generosity of donors. The American Red Cross has issued an emergency call for donations as they're facing a shortage. CAROLEE McGrath sat down with Red Cross spokesperson Kelly ISENOR to learn more about the need.
Right now, we're in a situation where blood is going out to hospitals faster than it's coming in, simply put. We are sending it out faster than we're getting it back in. So what we're doing right now is we're reaching out to in every public channel that we have and just reminding people that if you've been thinking about donating, if it's on your list of things to do this summer, now is a really important time to get out there and make that appointment.
Typically, is this the situation every 4th of July?
We know that there's always going to be a challenge collecting blood this time of year. In the summer, people have other plans. You're going to the beach, you're worrying who's going to pick the kids up at camp. I mean, there's just a lot going on, and it's totally understandable. But unfortunately, hospital patients don't get to pick the times that they're in need of that blood. And what we need to do as the Red Cross is maintain a steady supply so that as blood goes out, it's coming back in as well.
Tell us a little bit about the process of what happens when you go in to donate blood.
Sure. So the whole process takes about an hour. If you're talking about a typical whole blood donation, you'll be greeted by one of our donor ambassadors. They'll give you some reading material, health history questions, things like that. If you have filled out your rapid pass ahead of time, which we always remind people it's a good thing to do, that'll save a little bit of time. You're called into the health history area next, so they ask you some questions just about what you've done in the last 6 months to a year, medical conditions, medicines that you're on, things like that. They'll give you a mini physical, take your blood pressure and your iron levels. Once you've been given the okay to donate, the actual donation part is 10 minutes usually. Some people are faster. I've actually seen people that'll go together and compete to see how fast they are. We don't encourage that,
right,
but it happens. And then after the donation is done, you go into our canteen, get a snack. We give out cookies and juice, water, just something to kind of help you recover.
And what happens to that donation? It's divided up into 3 parts, if you could explain that.
Sure, yes. So once the blood is taken at a donation site, it goes back to our lab in Dedham. It's separated into 3 different components: your red blood cells, platelets, and plasma. And each of those components can be used in a different medical procedure.
If you could explain for the red blood cells what
Sure.
that would be used for.
So red blood cells are what most people think of when they think of blood uses. Trauma, surgery, anyone that's been, a shooting or someone that's lost a lot of blood, they're going to need red blood cells. The platelets are a smaller component of blood that actually helps in your clotting. So if you get a paper cut, it's your platelets that stop you from bleeding for 3 hours.
Okay, and what kind of patients would be using the platelets?
So surprisingly, a lot of people don't know this, more than 50% of the platelets that we collect go towards cancer treatments. People who have had compromised systems from chemotherapy or from other cancer medications use platelets to help with their clotting.
And you also spoke about the plasma as well.
Exactly, and plasma goes, there's more varied uses for it. We hear a lot about burn units, and also plasma is used in certain treatments for rare autoimmune disorders. My father-in-law was, before he passed, he was, for the last 10 years of his life, needed IVIG treatments, and those come from plasma.
And I think people probably wouldn't realize, the need and just how important that one donation is and how that can be used. But if you could also explain the shelf life of a donation.
Sure. So red blood cells, what I mentioned, last 45 days on the shelf, and that's because they can be frozen, but it's not perpetual. That constantly needs to be replenished. Platelets, unfortunately, can't even be frozen. Those last about 5 days on the shelf. So those are constantly coming in, going out.
And you have a particular need for type O blood.
Type O especially. Type O is the universal blood type, and especially O negative can be given to anybody. It doesn't matter what your blood type is, you can take O negative blood. So in a trauma situation, when you're in the emergency room and the doctor may not have time to test what your blood type is, he'll put or she'll put O negative into you.
And what about the missing type campaign? I know that that's something that you guys are you're talking about this summer.
Yes, absolutely. We came up with this idea that A, B, and O, as I mentioned, are the 3 major blood groups. And when those letters disappear, you start to notice it. And unfortunately, hospital patients notice it too. So what we did was team up with businesses and brands, companies, celebrities to drop the letters A, B, and O from their name or from their logo and just send a picture out on social media, and it's striking. When you see that, you notice it. It was just something that we wanted to do to raise awareness of how important those letters are.
And what have you seen? I know you spoke about your father-in-law, yes. But personal stories, if you could share with us of
sure.
What difference this makes in somebody's life.
It's unbelievable. There's a little girl that I've worked with she's 13 now. I shouldn't call her a little girl anymore in Billerica. When she was 8, she needed open heart surgery, and unfortunately, at the time that she needed that surgery, there was no O-negative blood. So her family and her doctors made the decision to postpone her surgery. Thankfully, she eventually had the procedure, and everything turned out fine. She's a beautiful, active, healthy little girl now, healthy young adult now. But what we do when we come out and tell these stories is to make sure that it never gets to that point for someone else.
Right, because it's a difference between life and death. And I was struck by the numbers of donations that are taken in per day. 14,000 donations per day by the American Red Cross across the country.
That's
astonishing.
It is, and here in Massachusetts, it's 372 units every day is what we need to collect to keep up with the needs of hospital patients. And there are days that we go above that, and of course there are days that we go below. Every 2 seconds, someone in the United States needs blood in some form.
And how do you encourage community groups or churches, to set up a donation?
Well, we have a team of account managers that if you're part of an organization that's looking into doing a blood drive, we try to make it as easy for you as possible. We give you all the literature. We help with promotional materials. We'll mention drives on social media and on our channels. We really want to give you the tools, but this is your blood drive, so we want that group to sort of take ownership of it and really just embrace the idea of getting people out.
But do you bring people in to run the blood drive?
We do,
right?
yes.
Yeah.
So
Most
at these sites, what we call mobile operations, we do blood drives in church basements. We do them in high school gymnasiums, in auditoriums. We've done them. I did one in Connecticut at the Yard Goats Arena. We can bring all the beds, the equipment, the staff, and all. It's actually an interesting procedure to watch when you get there at the beginning of the blood drive, how quickly everything is set up and it turns into almost like a makeshift hospital. It's really impressive.
Okay. Kelly, thank you so much for coming in and joining us today. And I know that the next kind of danger zone would be after the holidays for people to start planning for that as well.
Absolutely. It's, again, life gets in the way, and we know that there's family commitments, there's shopping, there's storms, there's driveways to dig out. But it's just something that if you take one thing away from this, just remember that there's always a need and that no one gets to choose when that need is. So we just need a constant stream.